All right, class, we're back to learning some drugs, and today we're going to talk about one that we definitely are going to use a lot, which is Ondansetron, more commonly known as Zofran. Again, this is an antiemetic drug so that we don't, or our patients don't have the need to having nausea and vomiting because of that. You're going to give this a lot when you get to the ERs and sometimes on the truck. So Ondansetron hydrochloride, and again, it's used to prevent and treat nausea. And truth be known is they don't actually kind of know how it works. That's kind of the weird part about it. It does settle your stomach. Again, it's antiemetic. Um, some other things that they can use it for, we'll talk about that in just a second. So it works against the 5-HT3 receptors. The simple long and the short is it kind of tricks your body into thinking that it's not nauseating. Again, it acts peripherally on the vagal nerve terminals, and it works on centrally on the chemoreceptors that trigger that zone. Everybody thinks that when you push Zofran that it has an instant effect. It takes about 10 to 30 minutes to actually kick in. Okay, so 10 to 30 minutes to kick in. And then the duration is about 3 to 4 hours. The older you are, if you have liver disease, it actually will last a whole lot longer. It's metabolized in the liver, so therefore it takes a little bit longer to go through that second and third stage passing where it breaks the medicine down. So what we use it for again is nausea and vomiting. Okay, so and we don't want people to continue to retch. When they retch, it activates their vagus nerve, which starts to slow down the heart rate unnecessarily, and we don't want that to happen. You want to, especially you got a really bad cardiac or somebody that's really retching hard. It's okay to get the vomit up again, but if they keep doing it, that retching is going to continue to cause problems. When they are vomiting, again, you got to make sure to protect the airway, of course. So a couple things that it will do is it does make you a little bit sleepy. It'll give you a headache. It actually can cause some seizures. Um, the extrapyramidal reaction. And the good news is if they do have one of these, this is usually when they kind of like freak out, or their head will turn and just stay like so. I can't move my neck. I can't move my neck. I can't move my neck. Good news is that's fixed very easily with Benadryl, by the way. So again, if they can get some chest pain, the blood pressure can go down. It can increase the heart rate, and the big one is that it causes bronchospasms to the respiratory. So again, you might want to keep an eye on those lung sounds after you've given Zofran. It can go either way with the gastrointestinal system. It can constipate you, it can make you diarrhea, it'll make you hold on to water. There are certain cases it'll actually make you pee a little bit more. But again, the biggest thing is at the injection site. If you do not push this slow, when I draw up Zofran, I always draw it up into a flush because I want to dilute it out, and I give it very slow over a couple of minutes, just to make sure that, and I make sure that the site is patent. If this stuff gets outside of the vein, of course, it hurts really bad, and you don't want that to happen. And of course, if it can cause an anaphylactic reaction as well. Now, so if they have a decreased liver function, we talked about that earlier. Again, with the elderly patients, the decreased liver function, it takes longer for it to wear off. So if you know for a fact that the patient's got a decreased liver function, stay away from Zofran. If they have an intestinal obstruction, stay away from Zofran. It's not going to help them. It's going to make it actually worse. And then if they're having cardiac arrhythmias, this is kind of a relative one. And the reason that I say that is they need to stop retching because that can make the arrhythmia a lot worse. So, again, make sure that it's kind of a relative thing. It can cause some arrhythmias. It can cause a little bit of tachycardia, which will increase the heart rate, which can increase the problems with the heart. All right, so if you do get an extrapyramidal syndrome, they start kind of freaking out on you, getting really spazzy, twitching. Again, 12.5 to 25 milligrams of Benadryl works really good. Again, you usually give that IV, and again, usually it almost corrects it almost instantly. You might have to redose them in a little while for the Benadryl, because the Benadryl will wear off before the Zofran will. Again, make sure you got to repeat your vital signs on this one. Got to watch out for the low blood pressure. Got to watch out for bronchospasms. So make sure that you listen. If you're in an ER setting, you're going to monitor intake and output, because again, it can clog people up. Urinary retention can happen. And use very cautiously if you've got a patient with kidney problems. If they got kidney problems, you stay away from it, probably, more than likely. So we usually give 4 milligrams over 30 seconds. Like I said, I put it in a flush and give it over a couple minutes. If you're going to give it intramuscular, we will use an undiluted 4 milligrams, and we usually give it in a single injection. These are usually the folks that we can't get an IV on. I'll go ahead and get the Zofran on board. And again, the other thing, by the way, is that they do have the melts that can go in the mouth that kind of go sublingually. They also have the tablets. But here's my little statement about the tablets. They're throwing up, and you're going to give them a tablet. Nah, it's probably a bad idea. The melts under the tongue work really good, though. Again, your pediatric doses, it's 0.1 milligrams per kilogram if they're underneath 40 kilos. If it's above 40 kilograms, then it's going to be just the 4 milligrams, okay? And again, go slow. Dilute it out. Please dilute it out, okay? We can give it IV. We can give it IO. We can give it IM. It can go by mouth. And this is heavily used in pregnancy. As a matter of fact, I know patients that have actually had a PICC line put in and had Zofran during their pregnancy when they had a hyperactive sensation of throwing up during the pregnancy, hyperemesis syndrome. So you can, so again, this is a normal thing. So it's a really safe drug for the ladies as well. Most of the time, guys, you're not going to have any problems with this drug. The biggest ones is you're going to have the bronchospasm, the occasional extrapyramidal syndrome that happens, and you got to just watch that blood pressure, okay? If they start getting hypotensive, again, give them some fluids to counteract that if possible. Just keep an eye on that blood pressure. All right, that's the end of this, and we'll see you on the next one, guys.